We'll start with attendance.
Yep, right here.
Sheriff.
Sheriff Kraus here.
Controller O'Connor.
County Executive Innamorato.
Rob Perkins. I think we may have a couple more members tonight, but we have a quorum already, so we can go ahead and proceed. Start with community corrections reports, passages to recovery. I didn't check my phone.
Good evening, Board. Greg Price, Director of Operations. For the month of April, reporting current numbers are current DOC residents 24. We had 0 self-injurious or self-harm behaviors, 0 COVID cases, 0 use of forces. In the month of April, 3 escapes, no revocations, no EMS returns or transfers, and 0 overdoses. I did mention to Councilwoman Hallam that there was we were testing for measles. We do not test for measles. I apologize to her. We work with our community partners, and they told us that they do not test for measles. We are trying to work with the county, the health department, to try to get those things if it becomes a problem. But we don't have any measles concerns as of right now.
Okay.
Any questions?
Any questions?
No, I was just going to thank you for clarifying, and if there's cases of measles, that would be handled through the Department of Health, not necessarily your responsibility. That's above your pay grade, I think. But thank you for giving that context.
Thank you. Renewal Center next.
Good afternoon, everyone. Darren Hood, HOOD, with Director of Reentry Services with Renewal Incorporated. Our current census today is we have 72 county and work release, 27 inpatient county, giving us a total of 99. We have currently 81 open beds in our facility. Our employment percentage is at 70%. Low due to some successful releases and new intakes. Average wage is $16.51 per hour. We had 61 reentrants exit the program, 34 successful, 12 escapes, 15 program revocations. Some were pulled out by court, some returned for behavioral issues. Numbers in general, we had 0 deaths, 0 non-fatal overdoses, 0 use of force incidents, 0 self-harm incidents, and 0 suicide attempts. The number of times emergency medical services were called and reported to either building for county reentrance since the last jail oversight meeting was 4. EMS were called for the following conditions: once for congestive heart issues, a second time for suspected allergic reaction to food, a third for severe back pain, and a 4th time for pericarditis. We had some special community service projects and other events over the past week. This past Friday, CCAC Northside Campus hosted the 3rd annual ACAR Reentry Summit. ACAR stands for Allegheny County Anchored Reentry Coalition. A lot of good vendors were there, outsourcing treatment and other specialized services. We had numerous county reentrants were in attendance. Renewal Inc. also had several staff members tending a booth and networking with various attendees. The Red Up Pittsburgh project started on Saturday, April 26th, and ends on Saturday, May 3rd. Renewal had approximately 18 county reentrants signed up throughout the week to participate in the cleanup and beautification of Pittsburgh. That's all I have to report. Any questions?
I had one question with respect to 81 open beds. Is that like an average amount, or does it range greatly from month to month?
It's kind of high right now, just due to slow intake and a lot of releases, whether they were successful or unsuccessful. But we're at 81 open beds. Yeah, we're high right now.
Are those, sorry.
No, go ahead, Barb.
I'm just curious, are those 81 beds just for Allegheny County residents of, or are those like federal beds or state beds?
No,
all beds?
we're contracted with Allegheny County Jail for 180 total beds and 150 males regardless of housing location, whether that be our Renewal 1 center or Renewal 2 center. Renewal 1 is on the Boulevard of the Allies, and Renewal 2 is located right next to the Allegheny County Jail. And we have 30 females, beds for females. So out of 180 total beds, we have 99 filled right now, leaving 81 open.
Okay, but I guess my question was, there are other beds that are contracted to other entities or?
Yes,
Okay.
we do have 2 other contracts with the Bureau of Prisons and also the State Department of Corrections.
And they have empty beds?
They do.
to Different, more beds. Okay, thank you.
I have one follow-up question. So if Allegheny County wanted to use all 81 of those beds, are they all available to Allegheny County?
Yes,
Okay. That's it. Thank you.
you're welcome.
Electronic monitoring next.
Good afternoon, Board. Steve Eswine for the Probation Office. Really, our numbers haven't really changed much in the past couple months for our overall population. For this reporting period, we did have 89 that successfully completed their sentences, and 6 were taken back for violations of the program. Any questions?
Does anyone have any questions? No? Okay, thank you.
Thank you.
So next is public comment and board actions, but we have no pending motions this evening, so we will reserve the comments until later in the meeting. At this point, reviewing the meeting minutes, does anyone have a motion to approve the meeting minutes from last meeting?
So moved.
Second.
All in favor? Next item, old business updates from the various JOB committees. I talked to the warden about maybe the warden could present an update on some of the work we've been doing, because it is a collaborative effort between the board and the administration, and we're really excited about that potential.
Sure. I think it was Tuesday, we had a subcommittee healthcare meeting. You came down with several, Ms. Griffin was there and a few other folks from the, citizens. We had our team there. We had a doctor there from Rehabilitation Center here in Pittsburgh. I thought it was a real productive meeting. I think that's the first one, maybe in a long time or ever. We talked a lot about relationships with the hospitals, relationships with all the entities that come in and out of that facility. But I think at the end of the meeting, we decided that we at least have to start the approach to start defending from within. We know we have to improve the relationships. We've had a lot of situations over the years down there that probably maybe would have went differently with different relationships with other entities. That's not making any excuses. That's just the way I see it. I think that us working together with you on these issues is a huge step forward. I think it's going to result in better outcomes for everybody, and we're looking forward to the next steps. We have some ideas on some things we can purchase down there, and we're talking about those with anybody that will listen, to make the intake area, starting in intake, I should have said that, starting with intake first. We've put some procedures in place down there with promoting a captain. Everyone knows Heather Greenwald is running that area now. We've put a lot of staff down there over the last couple of years, and Deputy Martin can comment on that if she likes, but I think we have to get to a place where now we start taking the next steps with, if there's technology available to us to help us with better incomes, and then building relationships with the local hospitals and the subcommittee or the committee working with us. I think we can really make some inroads in that. I thought it was a tremendous meeting. It was a very good couple hours. I hope you felt the same way.
I appreciate that, Warden. I believe we all did, and I think part of these meetings is for us to publicly communicate, what work is the board doing. So that was a several-hour meeting with, there might have been 20 people who spent the time to be there. And, one of the opportunities there is that the more people we have from more diverse backgrounds, the medical director at Gateway, somebody who works in a comparable facility but has perhaps different challenges, we can learn from each other, share resources, vendors, connections, things of that nature. That was a very positive experience for me to see the opportunity for collaboration. And as I shared before, that I've been on this board for about going on a year and a half, and just the transparency and the accountability from your leadership team has been an A+ from my perspective. And I mentioned this at our meeting. I know you're too humble to take all the credit, and you have a team, and it takes teamwork to get this done. But we appreciate that. I think it's on this board and the subcommittees to continue to meet regularly and make sure we hold ourselves accountable. But it was overwhelmingly positive, and we appreciate you spending so much time with us to discuss these issues.
Absolutely, thank you.
Ms. Griffin, you want to give an update on the issue you're working on through the subcommittee?
Yep. So I think one of the best accomplishments that the Oversight Board has done in the past almost year and a half that I've been on the board, along with Rob and others, is that we've created committees to start doing real work on the many, many issues that arise in this work. And even with our healthcare subcommittee, we quickly realized that there's even the need to divide and conquer those issues within the committee. So I guess I've created a bit of a subcommittee of one, which is to take on the issue of food and nutrition at the jail. It's something that has been raised by not only community leaders, but also by family members. We often, of course, hear complaints from residents themselves on that issue. So I've taken it on to do a bit of a deeper dive into that issue. I'm pretty sure we all understand the importance. I mean, food is just a fundamental, basic human need. It's important to everybody. It not only for health issues, just for comfort of life issues. So I've started by just doing a deeper dive and understanding what the issues are. We understand the importance, so I want to learn more about what the barriers are to making food better at the jail. So I met earlier this week from some representatives, started learning more about the importance of it and the issues, and I welcome anyone who would like to give feedback or meet with me to talk about food and nutrition at the jail while I'm undertaking this. I welcome that feedback. That's it.
Thank you, Barb. I'll give a brief update with respect to the Employee Welfare Subcommittee. The President Judge couldn't be here this evening. We continue to devote a lot of time and energy into discussing, with the warden and with members of the staff, what we can do as a board to help support, taking away some of the burdens on the staff there, because that's always been an issue, is obviously overtime, FMLA issues and things of that nature. They're very complicated issues. We're just trying to think about a positive way to problem solve to address those issues. One thing I would mention, and this also relates to the healthcare committee, is that the benefit of a board having this diverse group of people on it is that we have the benefit of experiences and resources. So with respect to the healthcare committee, for example, I know the executive staff is always very invested in the meetings, helping to do homework and research and things of that nature. And same thing with the President Judge. I know both her individually and her staff has invested a lot of time to work with the warden, work with leadership, and understand the issues from all perspectives so that we can be productive and do what we can to alleviate some of the strain on the staff and address some of the issues that have been going on for many years. So that's a brief update there. I think that's it for the subcommittee updates, unless anyone else has anything else.
Sorry. Just on the incarcerated welfare, I know we met with Deputy Clark, and hopefully next month we can finally do a plan for language access. Hopefully we can vote on that next month. So that's it. Thanks.
Hello, everyone. Sorry we were late. I do have a little bit of an update, not too much, but we recently learned, during the Incarcerated Individuals Welfare Fund committee meeting, that the second most common language spoken in the jail is not what we assume, which was Spanish, but it's actually Nepali. And so we've been, so we've been actually working to get some Nepali-speaking community organizations involved in the jail, and I will take responsibility for not working as fast as I should have. So an email went out yesterday, but the gears are in motion, and the whole board, especially the folks in that subcommittee, are committed to language access. And I know we had a great conversation about that. A lot of the complaints that some folks have, the jail was already doing. Maybe they can improve on certain aspects of it. But with the Nepali-speaking population especially, there is not the support that needs to be there. So that's something that we have been looking at very, very specifically. But that's about it. Anything else you want to say? Perfect.
Still good afternoon. So next week is a big week for corrections nationwide. It's National Corrections Week. They probably told the board about that last year, but I just wanted to mention that, and that's to honor all the corrections professionals that work nationwide. We're going to do a lot of special events down there every day. It's going to be really culminated on Wednesday with a ceremony where we're going to bring back a lot of retirees, and we're going to have a lot of readings and a lot of some speeches. But I just wanted to get it, recognize that it is Corrections Employees Week next week, and that's for all the employees down there. We're going to do a bunch of different special events that you'll be informed of. We have a really good group of folks down there who organize this, and they look forward to this every year. So we're looking forward to it the whole way throughout the week, to even on Friday, where the people sitting at these tables are going to be serving everyone else with our cooking skills. So we're looking forward to that. It'll be a really good week. On the 23rd, last week, we met with DHS. We got invited over for the Mental Competency Restoration Support Team Lunch and Learn. I think there was a few people here that were there. I thought that was a really good meeting. I know Director Dalton's here, and she's going to speak about some other things, and I'm sure she'll want to talk about that. That's to kick off the partnership with Centurion, and I've had some past relationships with them at other facilities I was at. I'm really looking forward to where that goes. I think that's going to be a huge advantage to our facility with regard to that specialized population, as we all talked about that day. And like I said, many of you were there, so I'm really looking forward to where that goes. I know that's been in the making for a long time to get to this point, so it was good to have that kickoff. I was honored to speak last week at the ACAR event. Spoke right before the mayor. Glad I didn't speak after the mayor. It was very motivating to hear everyone speak. There was a U.S. attorney that spoke. There was person who has my old job in the Department of Corrections. I got to speak. The mayor spoke, and we just talked about reentry in this county and how important it is and what we're doing down at the facility. It was good to meet all the folks in this county that really have a lot of interest in reentry and care a lot about the people in this county that are leaving the facility and where they go next. I want to give a brief update on the juveniles. We talk every month about the juveniles. We believe we're to a point where, and we're up to 17 now, I think, we're to the point where we've changed a lot of spaces on their unit. Next time you're there, we'll take you there. So we've done a lot of work on the actual housing unit, changing their spaces, making their days more structured. We believe the next level is working with DHS and starting to put some research-based best practices programming in place for them. We know they go to school all day, but we think that that structured time is good, and some unstructured time at night is okay too. But we want to start working towards some more evidence-based, nationally recognized program for the juveniles down there. And I've been talking to Director Dalton about that, and they're going to give us a lot of assistance with that. We're looking forward to that and keeping you updated on where that goes. I think that's really important. I mentioned in an email, I think this week or last week, about we're transitioning to the flash drives down there. We brought the major, Van Carey, up here to talk about that. This has been going on for, I think, at least 6 months, started before I got there. He's going to talk about the advantages of that and where we go with that, and he can take a few minutes, if you don't mind, to give you an update on where we're at with the flash drives for the legal work. Jack?
Good afternoon. About a year ago, I was approached by Mark Ganley from Commonwealth eDiscovery, and they started this program in Butler County, and it was very successful there. And we gave it a little time to watch and see where their problems were so that we wouldn't roll into that issue, any of the issues they had anyway. So we had talked about it, and I talked about it with some of the agencies we work with, and it was very slow progressing, I would say, because we had to buy equipment, get it licensing, and other things like that. A lot went into it. And Judge Avashovic got involved because we were starting to have trouble getting enough laptops for all the clients, for the attorneys that get them through court administration and conflict counsel. So she wanted an answer because we had waiting lists of people waiting to get laptops to view their discovery. So when I told her about the flash drive program, she was on board, and she said, well, whatever it takes, get it going. And she had Ann Garrett Stock get involved from the court administration, and we had meetings, and we worked with conflict counsel, the public defender's office. The federal public defender's office was already on board. I got invited to speak at the Bar Association's meeting in April. Andrew Capone invited me there, and that went very well. So everyone had the contact information for any questions. So what we did was we started this program not only due to the lack of availability of laptops, but the data size. When we first started them at Allegheny County Jail, they were mostly all federal laptops, and the discovery was just people would have stacks of papers. Instead of stacks of papers, they would just put it on a laptop so they could read it. There were some photos involved too. So that worked well. We only had about 20 to 30. Currently, we have anywhere from 125 to 140, just depends. Discovery's grown due to phone call tapes, all kinds of video that was never available before. There's police cams, all the cams that are on buildings and Ring doorbells and everything else. So the data that has to be fit on there is immense, and a lot of the laptops can't hold all the information. So the flash drives are a lot easier to load up, and then we have a hard drive unit, mobile discovery unit, we call them, that you can just plug it in and everything's there. It's also a quicker turnaround. If the attorney has the flash drive, they just have to drop it off, we encrypt it, and it's ready to go. The cost also is a big factor. Not only does it not cost the county as much, the different departments that had to get laptops, but private attorneys would charge their clients for a laptop, and if you get a decent enough laptop to hold all the information you need, it could run out to $700. And flash drives are anywhere from $15 to $99. So the average one that you need now is around $35. So it's a big cost savings to people that need to get discovery. Also, the laptops, they were moving around a lot, and people using them in the pods, and they would get dropped and damaged, where now it's a flash drive that plugs in, and we don't have that problem. We also designated secure viewing spaces for them to use. We used to do it in our gyms when we only had like 30 people, and then COVID came, and we started letting people use them in their cell, but they had a cellmate. And then we've sort of just had it on the pod. And unfortunately, we ran into a few incidents that you guys probably heard about of information getting out, or someone seeing something that's someone was testifying in a case, or other things like that, and they could actually show them on their laptop, look who's telling on me, and that caused some problems. So Now with these, this is you have a picture that I put up there. It's an enclosed unit. Only they'll be able to view it. There's no sound unless you put earbuds in, and we have earbuds for everybody that only they can hear what's going on. So it's definitely more secure. Everyone has their own individual password, and all the flash drives are encrypted. So they're the only ones that know their password, and they're pretty complicated passwords. We've rolled out 12 units so far, and so far, we started last week, and I've been going up and talking to the people that use them, and they all like it. I've actually had a couple of people ask me, when am I going to get mine instead of the laptop? And I said, well, we're working on it. Right now, it's quite a tedious task to get these done, so because we have so many to do. Anyone that's new, that's getting a new discovery that hasn't had anything, those are coming in on flash drives, and then we're slowly integrating everyone, and we'll work through to get everybody converted over. So.
Well, I've dealt with those headaches over the years, so I appreciate your efforts. I had a couple questions, and I think
Questions now, or we letting them all finish?
Oh, should I wait?
No, I mean, I have a lot if we're doing that now. I just wanted to know. I think it's better to do it like this.
Yeah, so this is the warden's report, so we can either pause and questions to the warden, or we can let the deputy.
That's true, yeah.
Let's let the deputy.
All right. We'll reserve our questions.
tons of
Yeah.
Okay.
That's all I have at this time. I'm going to send it over to Chief Estock, his report.
Evening, Board. For recruitment and retention, we had the June class has 30 active cadets who will have their psychological interviews from 5/5 to 5/22. April 29th was the first physical agility test for cadets trying to qualify for the September class. 9 of the 10 passed the agility test. 4 more agility tests are scheduled in May and June. The first-year officers, we've decided to conduct quarterly meetings with them, just discuss what's going on, hoping to identify issues in their training year that could be corrected to help with retention. If they're running into any problems or anything like that. Myself and Deputy Warden Young will be doing that, and then it'll be followed up with the major of the guard. We added the email on the bottom of the email, you'll see that join ACJ hyperlink. We added that a couple months ago. We're using it as a recruitment. I don't know if we're getting any hits on it, but it's worth a shot. Policy review. We're in the process of reviewing all our policies. We're using a multidisciplinary committee. Our committee currently includes people from health services, security, training, and accreditation. We're hoping that kind of gives us well-rounded policies and moving forward, very specific on, procedures, policies, and moving forward as well. That's all I have.
Good evening. On April 9th, the Foundation of Hope received a generous donation of $100,000 from Pat McAfee and Jelly Roll, who each donated $50,000. Obviously, this donation is going to aid the Foundation of Hope in its mission to empower people who are incarcerated. We've made changes to the visitation for the juvenile population. The monthly contact visit has been expanded from 1 hour to 2, and we've opened an additional non-contact visitation day on Tuesday evenings after school. In celebration of Second Chance Month, the reentry staff had a karaoke event on the reentry pod on the 24th. Participants enjoyed performing their favorite hits, and it was great fun for all. In April, we had 2 students pass their GED test. With the support of our partners from BPEP and League of Women Voters, 73 new voters were registered this month for the primary, and 31 absentee ballots have been collected so far. Primary ballots will be distributed and collected in the jail on May 15th. On April 23rd, the jail hosted a volunteer appreciation dinner. There are over 150 volunteers to support the jail in various aspects, and we're really grateful for the contributions that they make to support our population. At that volunteer dinner, Amy Kleisis from League of Women Voter and Lorraine Cross from the Black Political Empowerment Project were honored with Volunteer of the Year awards. They both have been instrumental in the voter education and registration events at the jail. They provide educational information to us on the election process. We're able to put that information onto the tablets. And they assist with answering a lot of questions for those that may be first-time registering or first-time voting. They coordinate, schedule, and organize a lot of different volunteers to come into the jail, and they provide nonpartisan educational videos that we share with the incarcerated population as well. So their efforts have really been impactful to the population of the jail, and they were honored at that event. As you are also aware, the jail and the Department of Human Services have been collaborating to develop and award RFPs for reentry services. Aaron Dalton has been gracious enough to come tonight to explain to the board where things stand with those contracts and what new services we'll be bringing into the jail. So, Aaron.
Thanks. Good afternoon. I'm Erin Dalton. I'm the director of the Department of Human Services. I think just before I speak a little bit about the reentry services that we're really pleased to be launching with the jail, just wanted to mention a couple of other things that the warden mentioned as well. So about a month ago, we were able to announce that the jail is now the first licensed opioid medication unit in Pennsylvania. That's a huge deal. It took a lot of work for many years from a lot of people here in this room and at DHS and previous jail folks. And so we're really grateful for that. That means that people who come into the jail who need medication-assisted treatment no longer have to have that treatment discontinued. And if people are qualified, that they can get inducted on life-saving medication. We're partnering with peer supports on exit, and so while we don't want people with substance use disorder to end up in the jail, if they do, they get the kind of care that they need and get that continuation of treatment in the community. So I think we're really, really pleased to be able to offer that. And then last week, we announced the competency restoration team. This, folks probably are aware that not everyone is competent to stand trial. And if you're not, and you can be kind of restored, you may wait up to 81 days to get sent to the state hospital for restoration, when that's not really necessary, right? So last year, 13,000 jail bed days were used by people who could otherwise be restored in the community. These are things, people that are safe in the community, that the district attorney, the courts, the judges agree would be safe to be able to be restored in the community. So with that innovation, which took a really long time as well. We're going back to 2014 when the ACLU filed suit against the state of Pennsylvania, not against the correction system, but against state DHS for those long wait times for people being able to be restored. So that's also really exciting. People will be restored, be able to participate in their trial, and get the care and treatment that they need. Most of those folks are being held on misdemeanors, so it's worth noting that as well. Going backwards a little bit on reentry, just to give a bit of the history. Lots of you were here, some of you weren't. The Jail Collaborative is celebrating its actual 25th anniversary. So this started back in the days of Dr. Bruce Dixon and Mark Cherna, Warden Lightfoot, and has been continuing ever since with lots of participation from the courts as well. We are actually nationally known for our reentry programs. One of our programs was found to reduce rearrest by 24 percentage points. Reentry programs work, particularly if you use science-based approaches, and that's what we were doing, and that's what we will be doing. Those programs suffered a big blow during COVID. It was just really difficult both to have people interact with one another, and staff come into the jail and services come into the jail. And so those programs suffered a big challenge during that time, but working with the jail, the courts, others were ready to relaunch. And so happy to be talking about that. And, that work takes a lot of effort, including people to review all of those solicitations, including people with lived experience and who have been in the jail working alongside of us, so I'm grateful to them. And we're about to announce $3.5 million in contracts to programs to come into the jail. So when I think about it, I see it as sort of two different approaches, both critically important. One, kind of more intense care for longer stayers. So as you know, most of the people that come into this jail exit really quickly. We don't have time to engage them in longer treatment, but for those who do stay a while, and that's about 40% of the jail, 7 weeks for men, about 5 weeks for women, we can work with them on a longer term basis with that goal of reducing recidivism. So we're offering a cognitive-based approach. This is evidence-based care. We're working with a group out of Philly, the Beck Institute, who is nationally known for being able to train in these kind of cognitive-based approaches, which we're going to infuse in all of the programs that you'll hear about. So in the really focused group cognitive-based treatment, we'll be able to offer that to about 550 men and 400 women each year. We'll continue that post-release. And then again, we'll infuse that kind of training into all of the programs. So some of the skills-based programs that we will also be able to offer include parenting and relationship building, job training and readiness, supports around mental and physical health care beyond what is already offered by the jail. And we'll be able to offer that to about 200 people a year. Those classes will primarily take place in the reentry center. And if I don't get an invitation to that karaoke thing next year, I'm going to be mad. That sounds like a lot of fun. So then the other main approach, and a criticism, I think, of the approach that we had taken in the past is, what about everybody else? We kind of need reentry for all. What about people who are on the pod who aren't able to go into those classes? And so we're excited to be offering that as well. So this will be available to everyone, regardless of length of stay. These will be activities that will happen on the pod, on the housing units themselves, things like yoga, art, book discussions, and we'll base those classes also on participant feedback, what people want, what's working, and those too will be infused with cognitive behavioral treatment principles. So you might be thinking you're going to yoga or participating in a book discussion, and you will be, but there will also be lessons infused in that as well. And the goals there certainly are about reduced recidivism, but also about increasing quality of life, both for the people who are having to stay there, but also for correctional officers and others who, this will be an opportunity for people to participate in pro-social events. And so we're excited about that. First time working on those kinds of approaches together. And I think an important piece is this all relies on a number of things, but I think importantly the discharge and release center and making sure that that is functioning really well. We know that recidivism is highest in the first 24 hours after release, and how people exit that jail, what they have, what they don't have, where they're going is really critical. So need to make sure we're continuing to work with the jail on that. Last, just to mention, I think next frontier work that the warden mentioned already is the juveniles. So it is impressive, I think, what the jail has been able to do for those young people in the last couple of months. And next frontier is to bring this kind of evidence-based care and services and supports for young people as well. The activities on the pod will be available to juveniles, but we need specialized program, as the warden's already described, and we're really thrilled to be able to work with the warden on that. Thank you.
I just want to quickly say before I kick it to Deputy Martin, how fortunate we are for Erin Dalton and her whole team. She is. I mean, these projects have, many of them, been many years in the making. These are not, programs that can be instituted overnight, and her team, if they're not experts in it, they'll become experts in it. They have made many of these things possible for us that I don't know that as a jail trying to tackle these issues alone we would have been able to accomplish. So our work is not done alone. We're very fortunate to have great partners with them.
Hi, good evening, guys. I was also going to talk about the meeting that they had last week, but I will skip that since everybody talked about it with the competency restoration team. They are up to 11 patients though that they are now serving, so they've definitely increased a lot over the couple weeks, which is wonderful. My other big news that I have is a project that myself and a couple other healthcare management has been working on for years, is trying to get into colleges to talk to nursing students, because there's about this much in the nursing book about what correctional medicine is. And we finally got to have our first visit with Carlo a couple weeks ago, and it was really good. The staff educator and our DON went and talked to the nursing class and answered a whole bunch of questions. So if you guys have any connections with any nursing programs, let us know. We can go let them know what correctional medicine is. That's all I have.
Any other wardens reports? No? Okay. Start with questions. Barb, do you want to start from your side?
I can't think of anything right now. So much good news and positive stuff going on. I'm sure there'll be something, but really congratulations to everybody on the progress that's being made on these programs.
Sure.
I just had a quick question, Warden, on the page 13 about overtime. Is that just COs or is that sergeants as well?
I believe it's sergeants also, sir.
Okay. I just didn't know if we can maybe split that, because we get a lot of concerns, and I did an audit on staffing in the past, but just maybe, if possible, if we could split that, because, we hear from the COs all the time, and, they report like ridiculous numbers of increase on that, but that would just be helpful so we could see what that split is.
Absolutely, we can divide it.
Okay, great, thanks.
Sure. Yeah, lots of great news. I love that you're starting the quarterly meetings with the folks who are in their first year, because that's when we've heard many times, this board has heard that that's when people tend to leave. So I just wanted to know if there was any themes that you've been able to identify in those conversations.
We're just starting them.
Okay.
Yeah. We are going to keep track of any trends that we see, anything that we need to adjust upon, more connectivity to those officers.
Okay, great. Thank you. Looking forward to kind of the feedback that we're receiving. So thank you all for your reports. Thank you, Director Dalton, and your team for being here as well.
I guess I'll start with Aaron Dalton. Everything you described sounds amazing. I had a couple questions about the logistics, and things change often and change over the years with respect to programming, but one of the kind of practical questions I had is, and I understand that you can't fix all the issues, but are there certain classification levels or certain charges or certain bond statuses that would prevent people from being eligible for these programs?
Yeah, I think that question's maybe more for the jail staff. I think from a program perspective, and I'll look to the team to make sure I get this right, we wouldn't be making any exclusions, but if people can't be moved to the reentry center for some other reason, security reason that I wouldn't be able to speak to, that might be an issue. So let me see if the jail's got a response.
So the only security reason why someone wouldn't be able to come is if they're on the restricted housing unit or if they're on one of our acute mental health units. One of the aspects that DHS has built into this new and improved reentry is using analytics to our advantage and being able to look at who's in the jail, the likelihood of how long they're going to be there. It's extremely hard in a jail setting to predict release, but we're trying to use some of those analytics to help us make determinations about priority for programming, who's likely to be here a little longer that might be able to wait a month or two, and who is not. We have the intensive reentry program where you get service coordination post-release, and that core population has priority, but the rest of the population will be able to fill in any other additional remaining seats, and we'll be partnering with DHS and using those analytical assessments to better select who gets into what class and when.
A related question to that is, and again, maybe this is a better question for the courts, but are the courts involved in these conversations? And I guess the context would be that, and I've been a defense lawyer who's postponed cases, so certainly I've been guilty of this, but one of the things that is perhaps avoidable in the local justice system is someone sits in jail for 10 months and then they get time served, but you don't know, they could get out at any point in time. Is there an opportunity to talk to the courts about maybe there's certain types of cases where the sentence could happen earlier in the case, and then we know with more certainty how long they'll be in the jail, and that could inform your ability to determine who should be eligible for programs?
Yeah, that's a loaded question. And it is more of a court-related question. I know the courts are looking at many different avenues to expedite dockets and get people moving through the system, so that might be better posed to them than us, but we would love to be able to have better ways. It's just traditionally for jails, that's a very hard thing to do.
Yeah, and as the deputy warden said, we have developed a model that predicts the likelihood that they'll be there a long stayer, which I think sets us ahead of where we were last time we were running reentry programs, where we were all those folks who got time served. We were failing to serve because we didn't think they would be there. So we had limited in the past to the sentenced population. Sentenced population is so small in the jail that that's not even a viable program anymore. So yes, we have built some analytics, and I think we'll see how well they do. But we could also fill in those classes with other folks if they're not full.
And I had some questions for the major about the computers. I know I've communicated with you many times, on behalf of individual clients. I never saw you in person, then you came to the Bar Association meeting. Now we're old friends. So I guess that I recently had experience where I had to wait, several weeks for a laptop, and we just don't have the capacity to have a laptop for everyone. But the two questions that I have, and they're probably a lot of defense attorneys have the same questions, because it really is important that people have access to their discovery so they can, be a part of their case, hopefully get out of jail as soon as they possibly can, and it does cause a delay. So I think this is absolutely a positive, but do you anticipate that people will have more access to their discovery, or less access, or equal access as opposed to before? Because I understand before you could, if you have your laptop, you can look at it all day in your cell, whereas now you have a more maybe limited opportunity to review your discovery because there's one kind of central station to review the discovery.
So part of it you might not want to hear, but Butler County did a study when they started theirs, and their usage dropped by almost 70%. Not because of accessibility, because they keep records of use. They have to sign up, and they use the blocks, and they can tell you down to the minute how much their client used the laptops. Unfortunately, a lot of people get the laptop. There might not be a lot on there. They view it, and then they're done with it, but because the phones are on there, everything that's on their phone is on there, so they get music, videos of whatever they have on there, and instead of using it for legal work, they're using it for entertainment purposes. Part of it, too, there's been people that play the music so everyone can hear it, and that's not going to be happening anymore. So if that's what they want to do with their time, that's fine, but they seem that the people that really want to use it for their case, they get it as much as they need it, as much as they want. But that's definitely something I'm keeping an eye on. We have extra units right now, and we're going to monitor how that's going to work once we get everyone involved with these. Right now, everyone that uses them, it hasn't affected their time at all. They get it as much as they want, the same as they would their laptop. Actually, the plan that's in the works, there'll be actually more viewing time into second shift. Right now, we only do it all on first shift, but if things go the way as planned, we'll open it up for second shift also. We don't have, if the jail would happen to be in a lockdown situation or everyone's locked in for count, that doesn't affect anyone that's using their, using the units. They can stay in there and keep using it through that time. If someone doesn't want to use their time, that time slot would be available for someone else to pick up extra time. It's not just going to sit idle. Anyone that wants to use it can use it. So I have a couple pods right now that have a lot of clients on them. So they'll get multiple units so that everybody gets equal time. So I don't see that as an issue coming up moving forward.
And the last question, with respect to the laptops, is it that, you may have addressed this before, but they have access to look at it confidentially? Like, I didn't know if they're by themselves in a room or they're right next to other people, or how does that work?
The units, the way they're set up, we can do them back to back if we need to. And you can only hear video if you have your headphones on. And those rooms they'll be monitored. But right now, like you said, just having a laptop, you can go pretty much wherever you want and do whatever you want with it. You're not supposed to, but it's hard to keep track of them all if you're on a pod working, if there's 20 people that have laptops. So now they'll be in a room, and that room's locked so no one else can come in. They can get out if they need to get out, but you can't get in.
That's all the questions I have. Thank you.
Okay.
You can stay there. I'll start with my jump drive questions first. Thank you for being here today. It's so nice to see your face at a jail oversight board meeting. Okay. First question is, so you said that they can only access it during first shift. So what's that, 7 a.m. to 3 p.m.?
Basically, it's around 8 o'clock to 2:30. They collect the laptops. But once we get the flash drives going, that won't affect when they have to collect them. Because like the laptops, they have to collect, track them. They all go out in the hallway. They lock them up in a room. The flash drives are going to stay there, and we have cases for them, and they can get locked inside that unit. I don't know if you can see the picture. It has a drawer, and we can lock them all in that drawer. So when the
bottom one or the middle
top
thing?
one.
Yeah. Okay.
So what we can do is lock them in the drawer. So when you sign up, we can just continually go right through. And when you're done, you unplug yours, and we come in, open up the officer will come in, open up the drawer, switch, next guy up, put it in, and they're ready to go.
Okay. Okay, so I guess I'm just trying to follow. So right now, if you are court ordered to have a laptop, you cannot use it after 2:30 p.m.
There are some people that do that have court orders for extended time. If your case, you're only going to get a short time before your hearing, we'll make sure you get extra time. We leave it out till 8 o'clock. That you can have it till 8 o'clock.
But that's a case-by-case basis thing. Like, that's not everyone.
Yeah.
The jail staff decides that?
Usually the attorney will contact me, and they'll give me the court date, and they can get a court order for extended time. I don't always require a court order because it takes time to get a court order. If someone tells me, hey, I just got this laptop, we have court next week,
yeah.
I'm not going to make someone try to get a court order and lose a couple days of them having extra time.
Okay. But absent that extension through court order, through an agreement, 2:30 is the cutoff now. Right. And so for this, I know you mentioned like you were going to roll it out on first shift, and then deciding how it goes, you would expand it to second shift.
Right. Currently, our policy is you would get it 2 hours twice a week, so that's 4 hours a week. But we're giving them every day, so they get a minimum of 6 hours every day.
Okay. And this room, can you explain to me, like, what room is it? Is it the room where right now, like, the tablets sit and charging on the pod?
Yes.
It's that room?
Yes.
Okay. And there is no staff that comes into that room with the person who's using the flash drive?
No.
Okay. And can you print stuff from these machines?
No. We don't have that capability now.
Can you get it?
Can we get it?
Yeah, I think that would be a game changer if you could get them to be able to print stuff too. So if maybe you could look into that, I think that would be awesome. So now, will there be no laptops at all? Like, will anybody have an exception? Like, what if they got a court order exception to have a laptop instead of the flash drive?
Well, right now, it's going to take a while to get this process all the way through. If someone gets a court order that it's laptop only, then we'll work through that. But the plan is to try to get everyone onto flash drives.
And have you talked with the courts to find out if people who have a current court order for a laptop, if you would still be in compliance with the court order if they got a flash drive instead? Do we know that, or are there going to have to be new orders that are handed down? I'm just trying to like anticipate hiccups with rollout.
We talked to all the attorneys on the cases, and no one said they had an issue with that. So.
Okay, do I only get one single flash drive, or are there, like, if I have 3 cases that are currently pending, do I have 3 different flash drives?
We can put them all on one flash drive now. We've had people that have had multiple laptops because it just doesn't fit. Now with the flash drives, normally if you use 512K, it'll all fit on there, but you can do terabyte.
Okay.
And that's.
You'd just get a bigger one if a bigger one was needed. Okay, cool. And then you were explaining how they keep them in this drawer. So that would be like everyone on the pod who has access to this would get a flash drive all in that drawer?
Yes.
And who would have access to get in that drawer?
I would, and the pod officer would have it.
Okay. All the pod officers throughout the day?
Yeah, because if you're working the pod and it gets unplugged or gets moved, you have to be able to reset the hard drives underneath in that big area.
Okay.
So they'd have to be able to reset it.
Okay. They kind of look like a voting machine, right? That's like kind of what it reminds me of. Okay. Next thing is, are they allowed to bring into that room like paper, pencil?
To take notes and stuff?
Yeah, to take notes and stuff. And then are they allowed to take their tablet into that room?
Yeah.
Okay.
Yeah, because that has the law library on it, so.
Oh, yeah, and you said this would be a faster process, that it would be, quote, ready to go. I wrote down in quotes that you said when it's ordered. Is that really like same day? Is it next day? Like, what's a realistic?
It's definitely not same day.
Okay.
We have people that have been waiting weeks for a laptop because, like he said, they're just not available.
Yeah, I've heard
sometimes.
that.
But the flash drive, you have access, you bring it in, and Mr. Ganley encrypts them, and he's there minimum twice a week. He'll come as many times as I need him to come in.
So like right away is like less than a week, is like 3 to 5 days.
Okay. No, less than a week.
Okay. And does this require any staff to facilitate the, letting people in and out of that room, to facilitate the getting the flash drive?
Just the pod officer for that part. As far as staff, monitoring them and keeping track of them and creating a list of where the people are and when they get them, that right now I'm doing all that. But that's going to probably require someone to, because I have a lot of other duties. But right now, to get this process working and running, I'm staying right on top of it to make it work.
Okay, cool. And that is all the questions that I have for you.
Okay.
Yes. Thank you so much for being here today.
No problem.
I hope you come every meeting.
All right, thanks.
And then I just have a few more questions. For Director Dalton, is she still here? Oh my gosh, I'm so sorry. I was looking behind Trevor to see you. I'm so sorry, Aaron. Specifically about the programs, you mentioned how he said like RHU was really going to be the only people that aren't having access to that new programming. I know the consent order like requires programming even for people in RHU, so is there some plan to expand the program? Oh, maybe this isn't a you question. Expand the program to like people specifically in RHU? Is that more like a jail security
Yeah, that's going to be for the DTU unit, and they will have their own specialized programming that happens on that unit. So
No,
they
I know
don't
about
come down to
DTU.
reentry.
I'm talking about the people who aren't in DTU. The consent order still requires them to have access to
I know that,
programming.
yeah, we've been looking at a variety of different options for that population as well. Sometimes people that are in RHU, they get packets of homework assignments and things like that. They just don't physically come down to the reentry center.
So you're saying they're getting programming currently? Or that's the plan?
It depends on the program. Some of the programs will do packets that they can do. Some, they wait until they come back out and put them back into classes. It just depends. And, I mean, this, as we're implementing this, that is definitely one of the areas that we're going to have to take a look at and see how we want to implement in that space.
Okay, cool. So right now, if there's somebody who's in RHU that wants access to programming, how do they let people know that they want to get involved in that?
There's like several different aspects to the programming, but anybody that's interested in programming in the jail can write the reentry program on the tablets, and then that program gets their information, lets them know what programs are available, and gets them on a wait list to get into the next class.
But a lot of those RHU folks don't have tablets, so that's what I'm thinking of, like the people who don't have access to tablets.
They still do get access.
When they go-
Or they could write.
Okay, or there is a way that they can write and still get it even with the tablets?
Just on a regular request slip, yep.
Okay, thank you. Oh, actual Aaron question. Is there an update on the study that Jens were doing about the $125 a month?
Yeah.
It doesn't need to be super in-depth, just like this is happening, we're on track.
I think that is for sure true.
Okay.
I have seen a written product and some slides.
Cool.
So I think we've maybe got a couple of next steps to follow up on, but we've done, I think, a big portion of it.
Awesome, and you're feeling good about it?
I mean, I'm not as up to speed as others. Ernest is feeling good
Ernest is
about
nodding
it.
yes, yeah.
Yeah.
Okay. If Ernest says yes, we're good, okay. Thank you for that. Also, you mentioned the jail collaborative. How do I get involved with the jail collaborative?
Yeah, I mean, so the Jail Collaborative has a number of kind of different pieces. They're sort of more the government partners that have been planning together for a long time. But then there's the kind of provider organizations that work within, the whole org. I think that's a good place, and I think we can think together with the jail as well about how we bring other partner organizations and the Jail Oversight Board into that process. Yeah. We can give report outs, we can engage and get feedback. I
want to be there. I want to be a part of it. We've over the years heard about it, and I haven't figured out how to break through into it.
We can follow up on that and see what the best ways to involve Jail Oversight Board members is.
That would be awesome. Yeah. Thank you for that. Sorry, I'm just going through my notes here. Oh, okay. The policies. Chief Deputy Isak, I think you were the one talking about the policies, and there's a committee who's going to refresh the policies. So one, who is on that committee?
You mean what discipline they are?
Sure, are they jail staff? Who on the jail staff is involved in that? I know you talked about some of the outside orgs, but what jail staff is included in the refresher of policies?
There's a captain, sergeant, officer on the security side. Healthcare is deputy.
Well, I'm on the committee.
Okay.
Karen's on there from the healthcare. Caught me off guard with that
We
one.
have MJ on healthcare too.
There you go. MJ's compliance manager.
Yeah, consultant.
Yeah, consultant compliance manager. We have a accreditation and training specialist on there. We're gonna expand it to anybody that's within that specific discipline. So if we're doing psychology policy, then we're going to bring people in from psychology. If we're doing specifically something to do with security or healthcare, we're going to use those people to review that policy, and just take that policy to where they think that it needs to go.
Okay, cool. So it's kind of dependent on what the policy is. It's not everybody sitting down going over these policies and.
Well, we have a core group that we're going to utilize. We didn't want to make it too big because, too many minds kind of slow things down.
I've been in those rooms, yeah.
So we started with a core group of people that we feel confident that will work well as a team in moving these policies forward. We're diving into all policies.
Cool. If you want any help, I would love to get involved. But truly, like, if we can be a resource, I'm sure anybody up here would love that. Me, just because, like, I want to be involved and I want to help shape the policies. If there's ever any opportunity, like, you guys get drafts and we get feedback, even if it's just specific things, please don't hesitate. Actually, please do that. Don't just not hesitate. And then truly my last question is, I don't have power right now. I know lots of people don't have power right now. It seems somehow downtown was like this magic space that didn't lose power. You didn't lose power at all? I have not had power. It is miserable. I'm not going to get into it right now, but it sucks. But anyways, if the jail were to lose power, can you just talk a little bit about, like, what's the emergency response plan? Like, we were supposed to get tornadoes, hail, lightning, all the emergencies. What would the jail do?
We come to your place.
No, I don't have power either. I just told you that. My whole neighborhood, no power. If Duquesne Light is listening, there's a tree down at the Woods Run Library. Please get it.
So obviously that place has been 30 years, which I should have mentioned that earlier when I talked about Employees Week. 30-year anniversary. It's hard to believe that place is 30 years old. So it's had many, many issues, weather issues. You know, I was down there the other night for that storm, and it is, as much as we talk about the internal systems in that place, and, you know, we've all talked about it before, the structure is great. The roofing structure, the outside building, it's a really good structure. We would move people around if we have to move people around.
Not out, just around in the facility. Okay.
Yeah, we would defend in place. Of course, we have contingencies with other counties. I've talked to, since I've been there, probably 5 other wardens around Pennsylvania, close by as possible, about contingencies if something really catastrophic happens. It would most likely be us helping them, probably, I would think, based on their structural needs. But we have plans in place that we would move people to different areas of the facility if we had to move people. Obviously, I mean, you're there enough, you understand, we're not going to be having gymnasium going on and things like that if there's a major storm going on, like might be this evening. So we would obviously utilize stairwells instead of elevators and things like that. So there are contingencies, and they're layered, that are in place depending on the event and how it plays out. But the minute something starts, we're automatically have people looking at how to get back to normal operations as soon as possible too. You always want to be looking at how you get back to normal as fast as possible to get back to your routine or your structure. But in a catastrophic event, we may depend on other agencies, but we go into every event with a defend in place approach.
Okay, cool to me. Thank you.
Thank you.
All right, that's a good thing about going last. Most of the questions I had were already asked. So, oh no, I'm not complaining, trust me. So I truly only have 2 questions left. But the first thing I want to say, it's important for me to just say how much that we all appreciate DHS. Thank you very much for coming, Aaron. But of course, Jen and Brandy, the whole DHS team, they do a lot, not just related to the jail, and you are greatly appreciated. So the 2 questions I have left, Warden, you mentioned in your report some plans, some ideas you have about intake. Of course, we all know how important intake is. You know, it's always the highest level of uses of force. That's, you know, when the highest probability of issues happening is when somebody is first coming into the jail. So we realize how important the intake area is. You mentioned there are certain things that we can purchase to improve the intake area. What exactly were you thinking? Can you elaborate on that?
Sure. So I think we announced this maybe before I got here. Since I got here, we have the opportunity, and we are doing it, to hire 5 EMS personnel to actually be in intake, embedded in intake. So they're going to be personnel who are down there all the time. They are emergency personnel. We need to equip them. So we're buying a bunch of equipment to make sure they have what they need to provide services, and life-saving services. That's the first thing. The second thing is, and this is a kind of a national movement, I would say, there's a lot of technology out there. The best way I can describe it is if you and I are in the hospital and the nurses leave the room, if something happens to us or something starts going on with us, the people outside get notified. We're looking at basically something like that would notify our medical staff in the intake area if something's going on with somebody in a holding cell, or someone is starting to experience something going on with his or her body. It would alert us if we're not standing there looking at them at that moment. There's a lot of really interesting technology out there regarding that, and we're moving forward with some purchases. We want to at least try it and see how it goes. But so that's first and foremost. Equipping our EMSs, and then looking at what we're calling health monitors or wearables, getting some things in place down there that help us identify issues.
Well, no, I look forward to seeing that, especially like the wearable technology. I think that would make a big difference. Okay, so my second question is kind of a personal one, but I think folks in the audience especially may be able to appreciate. If somebody wants to, put money on somebody's books for commissary, I know there are a couple ways you can do it. One way, there's a kiosk, in the physical building, but also, you can do it online. I always tell people connectnetwork.com. Is that the main way to donate money? Or the preferred way, is there? Or not donate, put money on people?
I would actually have to go onto our website and look. Usually we direct people through our website where they can do that, so I'd have to verify that and get back to you if that's fine.
Okay, I got you. The reason I bring that up is because that's the way that I've, done it for a few years now. I tried to do it recently, but somebody said that the person who's, the person who's commissary that I was trying to, put money on, said that they weren't able to make commissary purchases on it. They can only use it for like telecommunications purposes. Is there any reason that would happen? Is that like abnormal, or is there like a quick fix to that?
That doesn't quite make sense to me, because usually they can move their money around, but
We'll give you his name.
yeah, give me the person's name and I'll check on it.
All right, I will. All right, thank you. Do you know, I guess, like the manufacturer of the kiosk that's in the actual building? Or maybe like the software?
That's through Viapath.
Viapath.
Well, GTO.
Okay, I got you. Can somebody also donate through Viapath or GTL online?
I'm not sure.
Okay. Well, we'll follow up. I'll give you the name of my homie. Well, that's it for me. Thank you.
All right, thank you for the deputy warden's reports and warden reports. Time for the public comments. Luke Watkins. I don't remember you say last question. You never just told the truth.
Wasn't it the last question I said?
It's a lie.
I said last question, and then I asked about emergency response plan.
I don't remember.
Hello again. My name is Luke Devlin Watkins. I go to Pitt Law, and I shouldn't be here right now. And that's not just because I should be home studying for my final tomorrow, the last thing between me and my graduation next week, but also because I shouldn't be doing that either. In fact, I shouldn't be doing anything at all, because I should be dead. 4 years ago today, on May 1st, I found myself at the bottom of a pile of Pittsburgh police officers. I had run from them when they were called on me to do a wellness check, and I had never heard the noise made inside my head before when it hit the pavement, and I was certain I was about to die. Except I didn't, and I'd like to do some good with the bonus time it seems I've been given. So that's why I'm here. But the other reason I'm here is that despite being put in handcuffs and in the back of a squad car that night, I wasn't taken to the Allegheny County Jail. I was taken to the hospital, where I was cared for, where I was made whole again. but I didn't have to be. And if I had ended up in the Allegheny County Jail in May of 2021, when one, the jail's mental health care consisted more of OC spray and solitary confinement than medication and therapy, and two, the hospital had to put me in a full body restraint that night to keep me from hurting myself, well, I don't know. You tell me what would have happened. I say all this because I really like it here on Earth. And the only reason I'm here is because I got really lucky. There's people in that jail right now that did the same thing as me. There's people in that jail right now that have done less. There's people in that jail right now that haven't done anything at all. You, all of you, have been given a great and awesome responsibility by all of us. And right now, maybe you're paying attention. But if you choose to ignore it, people die. Full stop. And if I had been in the jail in May of 2021, and this board let me die in there, I wouldn't have gotten to do all of this. Like, I suffered my first real love. I suffered my first real heartbreak. I got into law school. I got to buy my childhood dog a Wendy's cheeseburger for his last meal on Earth. I learned how to forgive myself for things I didn't think I could and didn't think I would. I learned how to use chopsticks. I heard the birds chirp in the morning outside my window. I heard my name be called for prestigious awards. But above all, I got to help people. I just need you all to know that everything that has happened in my life since that day 4 years ago isn't because I'm special, it's because I'm lucky. The people in that jail, the people in your care, can do the same if given the chance. So do your job. Give them the chance. That's my time. Thank you.
John Kay.
Changing the life expectancy of our correctional officers. As the board knows, at different times I've mentioned to the board the life expectancy of our officers to be 61. Yours is 77. I, like others, have done the math. Some studies have found the life expectancy of correctional officers even lower at 58 and 59 years of age. I have presented, consulted experts in the field about this, and written about why this is the case. What makes the job of our correctional officers unique is that they realize each time they walk into the jail, they might need to physically intervene in a violent or potentially violent situation in a confined institution, and at times they do. Experts say that this has very significant consequences for an officer's physical and mental health over time, which partially explains why the life expectancy is 61. I recently talked with a correctional officer who is 49, and he told me he's planning on having only 12 more summers, wanting to spend as much time as he can with his children. With all the overtime he does and his decline in health, he believes he will fit into that category, that he will be dying around the age of 61. I recently interviewed a retired administrator of our jail. I asked him about this very low life expectancy of our officers. And his response was that this is something officers have to accept when they decide to be a correctional officer. I do not accept this. I will never accept this. I believe our correctional officers and their families have a right to have a future just like the rest of us. I have spent thousands and thousands of dollars of my own money on legal fees and sacrificed relationships with different advocates, primarily because I want to give our officers and their families a future. With all the positive changes Warren Wingard is making at our jail, including the establishing of peer support teams for our officers, we all should seriously look at how we all can increase our officers' life expectancy to, let's say, 65 in a few years. It is exciting to see our jail administration now working with different board members to share in the process of looking at different issues that need also to be related to the plight of the officers and their life expectancy and their families. The officers' input and planning is critical in this regard. Thank you.
Thank you. Next up is Lisa, I probably mispronounced your last name.
Pegas.
Pegas. I totally wrong there.
Hello, everyone. My name is Lisa Pegues, and I'm a mother of an incarcerated person at the Allegheny County Jail. First of all, I would like to say to Chief Deputy Estock, trying to get it right, thank you from the bottom of my heart for being accessible to me when I called you, for being open and honest with me as much as you could. I do appreciate that. Your efforts have allowed me to have a visit with my son, which before I talked to you, he wasn't allowed to have any visits. It was like, I don't understand it, but he wasn't allowed to have visits. I got in to see my son, and unfortunately, I need to report that before I got there, what I said here was told to him by officers. It was used against him. He was told, you stink. Maybe I should go and tell your mother that so she can report about that next time she goes to the Oversight Committee. And I also found out that my son was physically restrained and put in a corner cell with no heat in February, which I later found out that that wasn't supposed to happen. My question, okay, and I don't want to miss this. Also, there was a separation order in place by an individual that hurt a close member in my family. And on April the 8th, that individual was put into a cell with my son. If my son would have hurt that individual severely, or that person hurt my son, what would have been said about that? My son and other people, I want to say this too. What happens to my son affects me while he's in the Allegheny County Jail. But what happens to the population as a whole affects society as a whole. If you want the people who are incarcerated to be held accountable for what they do, then what about the peace officers that are regulating them? Do we need peace officers, police, and correctional officers? Of course we do. But we do not need peace officers and correctional officers that think that they can operate above and beyond the standard operating practice. We don't need them. I pay taxes to work. I pay taxes to be a homeowner, to city and state, and I'm paying for my son and other people to be treated that way. It's totally unacceptable. But I see progress being made, but I'm here to let it be known that we have not arrived. We need to keep going, and things have to change. And I just need to say, public speaking is not one of my things I like to do, but I keep coming back because it's needed, and I'm getting much better. Thank you.
Yeah, you did great. Maria Guido.
All right. Hi, Maria Guido. So I wanted to say that I continue to be impressed with the administration's efforts on addressing the juvenile pod, specifically with looking at trauma. We know that trauma significantly impacts youth involved in the criminal justice system, with a high percentage experiencing these traumatic events before and actually during their time involved in the courts. To continue to embrace this vision that you have for the pod, I believe that all correctional officers working with juveniles have to understandably educate themselves because research continues to come out more and more. engagement with these kids is key. Making a child feel emotionally safe is half the battle, because when you go in and you want to talk to a kid and they don't trust you, it's very hard to get anything out of them. But if you can engage them and make them feel safe, that's half your battle. I will say that there has been success in other facilities using a therapeutic approach called accelerated resolution therapy, and it uses a mixture of therapy interventions to decrease the physical and emotional responses to trauma. We have to remember that our kids facing Act 33 charges, they're in there for a pretty significant amount of time. So I think that this would be a good therapy approach to look at. I also think that it's important, we don't talk about this much, the connection of trauma and physical health. There have been, and this has not happened at the Allegheny County Jail, there have been stories in other facilities where kids who have had significant medical issues, they weren't responded to in time, and sadly a few of them have died. So kids with trauma tend to struggle sometimes that their medical issues or physical symptoms are overlooked because of their behaviors. So I think that that's just an important part that we keep in mind, that trauma not only impacts emotional health, but it also impacts physical health as well. And again, just would like to say I want to continue to thank everybody that comes here every month, that sits through these meetings throughout, listens to the entire public comment. It does make a difference. The community does see that. Thanks.
He's not trusting us on names anymore because I messed up the last one. Give it a shot, Rob. G is silent.
I'm a user.
G is silent. It's there to confuse you. Don't let it go yet. She's reading names.
Are you the chair or am I the chair?
She's reading names.
On this first Thursday in May, the National Day of Prayer, and as a representative of the Pennsylvania Interfaith Impact Network, I offer this prayer. O great and mysteriously creative love, please rain down on open hearts and compassionate minds wisdom, discernment, compassion, and the necessary strength of character and will that we might work together to care for our neighbors and some of the most vulnerable people of this county residing in the Allegheny County Jail. Give the county administration and council the clarity of purpose to provide the funding required to care for the medical needs of the incarcerated, as well as they do for any county employee with health care insurance. Place open hearts and minds of all the staff inside the jail to work with this new administration and DHS in making much-needed changes to enhance the ability for anyone inside the jail to come out in a better position to be responsible members of their families and communities. Please give this oversight board the tenacity to hold the jail administration accountable and to be open and transparent with the community by listening to all of the questions and answers each of the board members has, and to respectfully stay and listen to all the public comments at each meeting. We pray specifically for Judge Bigley and Judge Ivashevic that they will use the power of their courtrooms to hold more frequent detainer hearings and to release anyone being held on nonviolent charges out of the jail. We also hope, oh great love, that you will inspire them to encourage their professional counterparts to do the same. And finally, we pray that love will engulf the families and friends of those who have died inside the Allegheny County Jail. We pray all of this in the name of all that is holy. Amen. And now, if you're able, please rise for the reading of the names of the dead since April of 2020. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaugh, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Som, Nicole Barufi, Richard Shuba II, Terrence Clowney, Tracy Hickey, and Justin McAuliffe. Thank you.
Okay, Shannon Smith is up next.
Hello, my name is Dee Shannon Smith. I am the fiance of Lavelle Johnson. He's housed on 5B in the infirmary. He was brought there from the hospital to the Allegheny County Jail. He is having a lack of response for his sick cause. He had a walker, which he was not supposed to have a walker yet, and it caused his drain from his liver to suck from his bowel. He was supposed to be in a wheelchair at that time. There are several nurses that are refusing to give him his meds in a timely fashion. He has to ask for them for hours, and then he'll get them after, whenever they feel like giving them to him. I'm sorry. Wait a minute, I'm sorry. He asked them for a HIPAA form so that I could speak, and he finally got it yesterday. Also, his private health information is being revealed to the COs from certain nurses. I noticed that his voice is like aggressive at certain times, but it's because he's in pain. He's scared that he's not going to make it out of there alive, which yesterday, he has been complaining like all week. Yesterday, he was taken out of the jail back to the hospital. And I just want him to have the proper care. No matter what, he's still a person, and I think he deserves proper care. And that's pretty much it. Thank you.
Thank you. Tanisha Long.
All right, Tanisha Long. So first, I'm going to start by saying that we have worked really hard to see a lot of the changes that we're seeing at the jail. We've worked for years. I always say that my ideal job is to not have one anymore, and that includes this work at the jail. So it's very heartening to see a lot of the things that are happening that are different. It's great to hear about the new programming coming. It's great to hear that the programming is going to be accessible to everyone. It's great to hear about changes to the juvenile pod. If we get all of that implemented, these will be the things that we are working towards. We still have a lot of uphill battles, but it's good to see that things are beginning to change. Also, I would like to say that I had the pleasure of going to the jail's volunteer dinner. I know y'all thought I was banned forever, but no. It actually was a wonderful event, and you could tell that the staff there really cared about the people who come in and out of the jail and provide that experience for incarcerated people who aren't jail staff. Because I do think it's important to see people from the outside and keep that foot in the community so that you have your connection there. Now, what I will say is, we just heard Shannon's testimony about her loved one, and I think it's very, very important that we point out that he's not the only one, right? There are a lot of people I talk to in the ACJ who believe that the standard of medical care that they're getting in the ACJ does not come close to matching what they would get if they were outside. We've had people come up here and talk about, people who have bullets in their heads and not receiving CT scans, not receiving orthopedic shoes, not receiving wheelchairs, being given alternative assistive devices. We've heard tell of medical records not matching, their experience, or hospital orders not being followed. There's a growing sentiment among incarcerated people that, and this is a quote, "I feel like they're waiting me out. I feel like they don't want to pay for this care, and I feel like they're waiting for me to either die or get transferred." And it's not something that we see every once in a while. It's something we hear quite often, actually. And I know there's a lot of work to do to reverse some of the things that were persistent for damn near a decade. But we kind of have to start doing it faster. And we have to have this standard and this approach that if I were to get sick on the outside, I would have the same level of care that I would if I got sick inside the ACJ. I think we've done a great job of starting to reverse the trend of deaths in the ACJ, but the worst thing that can happen to you is not always death. It's living a life with injuries and being maimed and with trauma that follows you forever. So I would like to see a more intentional approach to that, and we do have some medical advocacy letters that we will be presenting to you by the next meeting. Thank you.
Thank you. Motion to adjourn?
Wait, before you adjourn, Kevin, because I don't want to take this from you. At the bottom of the agenda, there's the additional announcements. We need a solicitor. Have we received any applications for solicitor? Can anybody update us on that?
I think Encore.
Isn't the controller's office taking?
There's a spreadsheet that gets
But it's blank every time.
And I think
And I know of 2 people who applied.
I don't know then.
So we'll get it on comment. Each member gets a recap as.
It's blank.
That would be correct because it generates a report for all of the applications that were received in the previous month. Of record, there is only one, and that has also been provided to the board.
Okay, so we have been talking about this for months. Can we make a plan before the next meeting to to do something with the solicitor? Like if we have one application, can we interview that person? Can we please move forward with this? Any objections? Okay, so I don't know who's handling that, if that's you, Encore, handling reaching out to the person who applied, because I don't also want us to go months after someone applies for a position and we just
Yeah, just to follow up, that is a recommendation that the board would make. It's not.
Okay. Does anybody have any suggestions on at least next steps? What can we do to move this along?
Why don't we talk about it and put it on the agenda for next month, and we can think about what the issues are. Well, I think one of the issues was the pay was not good, so I'm not sure if we got that many applicants. So
But we at least got an applicant. Now, 2 people told me they applied, so I'm gonna have to hook up with you and figure out which one of those 2 didn't. But yeah, if somebody applied and somebody wants to take the job for not a lot of money, can we do something about it?
I think we should just make sure we have a pool of qualified applicants. I don't know who applied. I haven't interviewed anyone. I know the issue was a county residence too, so I think that it requires some discussion. So we should put it on the agenda and talk about it.
I don't know how long it's been now. I know we've been talking about this for a while, but it has been over a year.
I'm with you.
Okay.
I want to get a solicitor.
Cool, just because it was on there. Now, Sheriff Kraus, it's all you.
Motion to adjourn.
Trevor.